Now I'd like to invite Dr. Audrey Adji from the Victor Chang Cardiac Institute to talk about measuring arterial pressure in individuals with no pulse. Okay, are you able to share the screen? Perfect. Are you there, Audrey? We can't hear you.
Okay. Okay, can you hear me now?
Yes.
Okay, I'll start again. Okay, my talk today is titled, Can Arterial Pressure be Measured in Individuals with No Pulse? So the answer is yes, but how does a human live without a pulse? Our lab manage and treat end-stage cardiac failure patients. To keep them alive while waiting for heart transplantation, these patients are fitted with left ventricular assist device or mechanical hearts for short. These devices work by pumping blood continuously, making these patients pulseless. This no pulse state makes conventional blood pressure measurement difficult and inaccurate. We cannot even measure blood pressure manually as there's no critical sound. Currently, there's no gold standard protocol to measure BP in this unique cohort. BP is known to be one of the strongest determinants of stroke in patients supported by continuous pump, and is further associated with pump blockage, bleeding, and other adverse events. Therefore, it is critical that BP is measured. Our study was to measure these patients' BP level using a commercially available device, Figmocor XL. So between February 2019 and June 2020, we assessed 15 patients for their blood pressure. The study group consists of 13 men and 2 women, and BP was taken generally at 1, 3, 6, and 12 months post-implantation up to the time of the heart transplantation. As I said, BP is measured by Figmocor XL with brachial cuff attached to the upper limb. We collected a total of 71 successful recordings, that is both oscillometric blood pressure and brachial waveforms acquired. This was able to be completed despite low pulsatility of about 15 millimeters mercury. XL was able to automatically calculate central systolic, diastolic, pulse, and mean pressure in 44% of these patients. The rest, which is 56%, pressure were processed offline using a low pass filter by extracting details of brachial cuff waveforms. In 2 patients, however, XL was unable to automatically calculate pressures in all their recordings. A representative XL report is shown here in my slide. Comparison was then made between central pressure values calculated automatically by XL and manual offline processing, where significant difference was found between systolic and pulse pressure. Central systolic was generally higher in the XL-generated report, and this overestimation was reflected in the greater pulse pressure reported by XL. I should indicate, though, diastolic and mean pressure was similar for both techniques. Our conclusion is that blood pressure can reliably be measured in patients fitted with mechanical hearts despite having very low pulse. Suboptimal blood pressure management and reduced arterial compliance associated with higher mean pressure have been associated with stroke, bleeding, and pump blockage due to clotting. Therefore, better BP measurement and management is vital in reducing adverse outcomes in these patients. Thank you.
Thank you very much for that. I can see there's a question here from James Sharman, and it says, did you have any invasive BP to compare the XL readings?
To answer that, yes, there's another study which I wasn't involved at that time, but yes, it was compared to invasive measurement, and we found something similar. So the Figmocor XL actually overestimates systolic by about 8 to 10 millimeters mercury compared to the invasive study.
Okay. And another question here from Jonathan Minyard asking what is the difference between offline processing and what the Spigma core does online?
Yes, so Spigma core has a built-in algorithm where it can calculate the central pressure automatically. So it'll produce a report similar to what I've shown you in my slide. Now, in some patients, the system weren't able to calculate it automatically. So what we did is we took the waves as a raw waves and we process it with our offline processing with low pass filter. And we were able to extract the information contained in the wave and estimate the central pressure, such as systolic, diastolic pulse, and mean pressure.
Okay. Thanks for that, Audrey. In the interest of time, I think we might end questions there.